What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. No one really wants to ever have a surgery. I think that's fairly obvious. Most of the people that I see have pain symptoms. A large majority of them will respond to a conservative management route, and a handful will actually need to go on to have surgery in order to decrease their pain and their overall function. The common treatment options in my world include watchful waiting, injections, over-the-counter medication, bracing, and then eventually sometimes surgery. And the one thing that everyone always wants to avoid is, again, the surgery or the injections. Both are invasive procedures, and for one reason or another, some people will choose, essentially to do one or the other, or just kind of watch and wait. And a common thing people will tell me, I would never do surgery. I would have to be completely incapacitated before I decide to have surgery, or it is the very last option that I will ever do. And I completely understand that. There's a lot of, fear and cost and time investment when it comes to surgery. So I understand. Aside from the invasive nature of it, I understand why people do not want to consider it. Or a large portion of my patients do not want to consider it. Some people are the opposite. They're definitely pro-surgery, but that's for another day. So I want to unpack a little bit the decision to not do surgery until someone is completely incapacitated. Again, with a lot of the procedures and injections, some people will do injections mainly to control the pain in order to maintain their overall function. Now, what I think is missing is the side effects of pain. The side effects of pain include decreased range of motion, decreased cardiovascular reserve, muscle atrophy, and generalized deconditioning. Those are some of the features that I think are underappreciated when people have a pain syndrome. If we can get away with an injection or a medication to make the pain go away, the hope is that if pain is controlled or gone, then all these other factors will just kind of catch up, reverse themselves, so on and so forth. And I think for the most part that holds true until a point. And what I mean is, with conservative treatment and time, you have to measure, are you actually getting back to your previous level of activity? Oftentimes people will make sure that the pain is well controlled, but their function level just never really gets back to where it wants to be. So just using a crude example, let's say that someone is, doing 20 minutes of a run, and for whatever reason they develop pain. They come in, I give them their options. They get an injection or a medication. They get back to their 20 minutes. Everything is good. Now, at some point in time, or with certain patients, they'll start to get pain around 19 minutes. They get an injection and they get back to their 19 minutes and they're happy, but they never really quite get it back to that 20-minute mark. Again, fast forward, time, recurrent pain episodes, it becomes 18 minutes. And then they try to get to 19 minutes again, but they fall back to 18 minutes and they're just happy to have 18 minutes. You don't want to push it. You just be happy with what you have. And then at some point, they get down to 1 minute, and the medications and everything that they're doing is only allowing them to get to 1 minute of running. Now, for a lot of people who like to run, that's not adequate. That's maybe there's a subset of people that are happy with 1 minute of running, but if you used to run 20 minutes and now you have to ice and medicate and inject and brace, and then all you're able to do is 1 minute. A lot of people, I think, would not really like that. So let's say your condition is fixed, you get a surgery and everything's fine. Now, pain is gone. As soon as you're cleared by your surgeon, do you get back to 20 minutes? And the answer is no. You can try, but physically, you are not able to do 20 minutes right off the bat. And I think that's the point when this line of thinking starts to fall apart, is that in one direction, the pain was gone. We could get back to a physically active level that we were satisfied with. And then a surgery happens, the pain is gone, and you cannot physically get back to that previous level of activity. And so this is the trade-off of waiting in the big picture of things. Now, after the pain is controlled, you have to regain your range of motion. You have to regain your strength. You have to work on your conditioning. You have to work on generalized mobility because, again, if you're only able to run 1 minute, I guarantee you your body has made a lot of other changes in order to accommodate that little bit of 1 minute running in addition to your day-to-day activities. So you have to undo that, and that takes time. Now, there's also the age factor. It's one thing to wait 6 months to get to this point. But again, if you are that person that is waiting years, in that amount of time, your body has also aged, and just from just being alive. These are not the changes associated with becoming less active. These are the changes of being less active in addition to someone that is aging. So the context does change, and that does make a big difference. I think that's one of the, major concerns from my standpoint as a clinician when trying to counsel my patient, because I do not want to bluntly paint a gloom and doom picture, because I think that, if anything, that just reinforces their decision of waiting until they're completely incapacitated. But I've started to frame the question of more of when is it that you want to start your rehab? Because that's really what it comes down to. No matter what happens, pain is what slows people down, but the rehabilitation part starts after or during that period. When do you actually want to start that? And do you want to start rehabilitating your knee when you're 40 years old or when you're 60 years old or 50 years old or 75 years old? To me, that's where surgery comes into play, is that it treats a single problem and then allows you to start working on all the other things. When people become completely incapacitated, they are the weakest, the most painful, the most deconditioned, and just from a biological standpoint and mental health-wise, they're probably not in a good place. Now, the pain can improve after, let's say, like a knee replacement, but then there's still a significant amount of rehabilitation time. All of those factors that come along with becoming completely incapacitated, those are all poor prognostic factors for a fast recovery. So you almost have to take that into account of if you are going to wait until you're completely incapacitated, are you mentally ready to begin this road with all these negative factors that have accumulated? I think that's a really different way to ask the question. Again, it's not my way to try and scare someone into doing the surgery, but I try to gently bring that up because it is a significant factor. There is a cost to waiting. It may not be, something that you realize in the moment, but eventually you do have to pay that bill. And I think if you wait long enough until you're mentally ready to do it, just be prepared on what you're still going to have to do at any point in time, which is rehabilitate your knee. Anyhow, I had to drop this one episode with you guys because I think it's a conversation that is not really discussed as a factor of decision making. A lot of times my patients are really focused on, is it bone on bone? How torn is it? And to me, that's like the last, it's interesting, that's like the last thing I'm concerned with. It's more of like how well are you moving? How well is your pain controlled? And how long can you live like this? And are you okay with it? Those are my questions. So I hope this was helpful to you guys. Just some food for thought. I'd love to talk about this more, so make sure to find me on social media and let's get this conversation started. Thanks again. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.